I am Dr. Jameel Akhter, a senior consultant general laparoscopic surgeon working at Apollo Hospital, Greaves Road, Chennai. Uh, I would just like to give a few lines on certain main conditions which we encounter on a regular basis. Like a gallstones. A gallstones is a problem which almost every house somebody encounters. Gallstones can cause multiple problems, mainly acute infection, chronic infection, pancreatitis, jaundice. So deal with your gallstones on time, as you don't want to land up in all these kind of issues which can become a lot of difficulties in treating it. If you present to us at right time, the procedure is very simple and you can be discharged on the same day and you can resume to the work within no time. Same way, a hernia is small. So they say, no, there's a saying called stitch in time saves nine. Stitch in time saves nine means when you get a disease and you come to the doctor and get it repaired on time, it helps you to for better recovery. So a hernia which is small, you can if you get operated, the pain is less, the procedure is simpler, and recovery is fast. So if you leave behind a hernia can grow up into a irreducible hernia, can become a giant hernia, and it becomes very difficult to treat them. You will have land up in a resection of the bowel. You can land up in mesh infection and multiple problem. The intestine is gangrene. That chances of mortality is also there. So get your hernia repaired soon. Earlier the better. Okay, the outcome is also better when you do it at right time. Now coming to a procedure called gastrointestinal reflux disease, which is a GERD with hiatus hernia. So the hiatus hernia is one of the most common problem we encountered on a regular basis. So does all hiatus hernia and GERD require surgery? No. There are very few candidates who would benefit from surgery for hiatus hernia. So hiatus hernia, if multiple tests are done before you become a candidate for surgery. So you do a endoscopy, you do a 24 hours pH manometry and GE reflux study. So based on these studies, if and on being medical treatment for long time, the treatment and the symptoms persist, then you may be a candidate for hernia repair. So hiatus hernia, especially it is a stage 3 and 4, that would require surgery. A simple hiatus hernia just with GERD definitely does not require surgery. So the hiatus hernia surgery basically involves pulling down the tube, the esophagus and the stomach down into the intestine, to the abdomen, and repairing it, plicating your stomach, folding your stomach, and so that it does not go behind it. So it can be done both laparoscopically and robotically. So the advantage is that this GERD and hiatus hernia chances of recurrence are very less, because once that uh, esophagus is pulled down, it does not cause acidity, reflux, and hence you will feel better. But do not get surgery for hiatus hernia just like that. You need to be properly evaluated, because a improper evaluation and surgery can land up in a lot of trouble, retching, and sometimes you might require unfolding of the hiatus also. So please choose a correct treatment and then go ahead with the surgery. Okay, now coming to something called rectal prolapse. A rectal prolapse is a problem which we see in quite a few patients who have a chronic constipation and who are always straining at the stool. So when they strain at the stool, what happens, a part of rectum comes out, and they have to push it each time once they go for a bathroom. So every time you push in, it goes back and it comes out when you give pressure. There sometimes it can be outside also, and you if you push back, it may not go in. So this also has multiple grade. It's called full thickness rectal prolapse or partial prolapse. So this kind of problems also would require a surgical approach, which can be done both laparoscopic and robotic. So what in this method, what we do is we go laparoscopically or robotically inside your abdomen, pull the rectum up and fix a mesh beneath the below the rectum, so that the rectum is held in place and does not come out again. And also you will require sometimes a biofeedback mechanism, so that your constipation and other sensation is intact, kept intact. Now, there are certain procedures like major procedure which are we do laparoscopically. Like if you have a tumor in the something called colon, ascending colon, or maybe a cecum. So these areas, the patient they present with a lot of bleeding. They'll be having anemia, weakness, loss of weight, loss of appetite, and when they come to us, the hemoglobin is sometimes 5 6. So especially people with anemia of unknown reason, and especially with somebody who had a bout of bleeding, so we do a colonoscopy, and we tend to see if there is a tumor in the cecum or in the ascending colon, and do a colonoscopy, do a biopsy. On biopsy, if we find it is malignancy, then we go ahead with the CT scan and something called a stage the tumor, stage the disease. So once the stage is, we know that it is operable, what we do is we remove that part of intestine called, his procedure is called hemicolectomy. So we take that part of intestine laparoscopically, remove it, and send it for a biopsy. Remove the whole part of the half of the colon from the ileum to the transverse colon, and we join the ileum and transverse colon together in the laparoscopic or by a small incision. After the biopsy report is we get the report, we see how whether the patient would require a chemotherapy, and medical oncologist advice is always taken, and accordingly the advices are followed. So these kind of diseases which are very common these days, initially the number of patients presenting to us with malignancies was very less. In the recent past few years, the number of patients that are presenting to us with malignancies have really gone up, and a definite regular checkup is mandatory. If you have a bleeding per rectum, you feel that you are feeling tired, there is anemia of unknown reason, please get your colonoscopy done and meet the doctor, so that further assessment can be done, and the whatever is best suited procedure or treatment required for you, it can be done. Thank you.